Hello everybody. We are listening the video presentation of Dr. ATAD, dated July 2025, on the global use of the ATAD Cook cervical double balloon device for induction of labor and for the effective treatment of uterine emergency bleeding conditions. I was graduated in November 1974 at the Technion Institute of Technology, Faculty of Medicine, Haifa, Israel, and obtained a specialty degree as an obstetrician and gynecology on September 1984. My career milestones are as follows. On 1980 to 1982, I was the acting head of gynecology at the University of Cape Town, South Africa. On 1990 to 2000, I was the head of gynecology at the Carmel Medical Center, Haifa, Israel. In 2005, I invented the double balloon device for induction of labor. It is an FDA-approved device. The same devices are also used efficiently for uterine bleeding emergency condition as published in the medical literature. I will present now the marketing details of the device. Initial marketing started in Israel and Europe by my company ATAD Development Ltd. On 2005, there was an acquisition of the global sales rights by Cook Medical, Bloomington, USA. Here we can see the official approval of the United States of America FDA of the devices. And here, when there was the acquisition of the global sales right by Cook Medical, Bloomington, USA, where we signed our first agreement. Here we can see my lecture presentation in over all locations, like here in China, lecture in front of doctors and midwives. And now we will see how the device is inserted in all the states of the insertion device in the procedure animation.
The Cook cervical ripening balloon is intended for the mechanical dilation of the cervical canal prior to labor induction at term, when the cervix is unfavorable for induction. Before you begin, perform an abdominal ultrasound to confirm singleton, vertex presentation, and to rule out partial or complete placenta previa and/or placenta percreta. Place the patient in the lithotomy position and insert a large vaginal speculum to gain cervical access. Before you insert the device, prepare the cervix by cleaning it with an appropriate cleaning solution. Loosen the fitting on the proximal hub of the stylet and adjust the wire so that the distal tip of the stylet is even with the distal tip of the cervical ripening balloon. Tighten the fitting so that the wire does not move during manipulation, and seat the adjustable handle firmly into the blue port labeled S. If necessary, use the cervical ripening balloon with stylet to traverse the cervix. When you have traversed the cervix and the uterine balloon is above the level of the internal os, remove the stylet before you advance the catheter any further. Advance the cervical ripening balloon until both balloons have entered the cervical canal. Inflate the uterine balloon with 40 milliliters of sterile saline by using a standard 20 milliliter Luer lock syringe through the red check flow valve marked U. Once the uterine balloon is inflated, pull the device back until the uterine balloon is against the internal cervical os. The vaginal balloon should now be visible outside the external cervical os. Inflate the vaginal balloon with 20 milliliters of sterile saline by using a standard 20 milliliter luer lock syringe through the green check flow valve marked V. Once the balloons are situated on each side of the cervix and the device has been fixed in place, you may remove the speculum. Add more fluid to each balloon in turn in 20 milliliter increments until each balloon contains a maximum of 80 milliliters of sterile saline. Take care not to overinflate the balloons. If necessary, the proximal end of the catheter can be taped to the patient's thigh. Please note that the device is not intended to be in place for longer than 12 hours prior to the planned induction. To remove the device, deflate both balloons through the corresponding valves marked U and V and remove vaginally. Please see the cervical ripening balloon instructions for use for complete instructions and warnings.
Today, my presentation and the following book presentation, which are the result of my personal effort to sum up all the information on the subject, are both focused on publications regarding the various use of the ATAD Cook cervical double balloon devices between the years 2005 and 2025. The book chapters are as follows. Chapter 1 and 2 are referred to labor induction and will not be discussed today's presentation. My lecture today will focus on several other emergency conditions based on medical literature where the double balloon device have been used effectively to manage emergency uterine bleeding conditions. The chapter book 3 to 7 are as follows. Chapter 3, Massive Hemorrhage in Cervical Ectopic Pregnancy. Chapter 4, Ectopic Pregnancies on a Cesarean section scar. Chapter 5, Post-abortion massive uterine hemorrhage controlled by balloon tamponade. Chapter 6, Control of low-segment intrauterine massive postpartum hemorrhage following placental detachment. Chapter 7, and the last one, Hemorrhage following cervical conization surgery of uterine cervical neoplasms. I will now discuss each of the above chapters of the book separately. Chapter 3 is related to massive hemorrhage in cervical ectopic pregnancy. Here we are talking about relevant literature citation. The ATAD Cook cervical double balloon, a successful treatment for massive bleeding in cervical ectopic pregnancies. This subject was published by Turgal, Ankara, Turkey on March 2016. A patient was admitted to hospital due to massive cervical bleeding, approximately 900 milliliters. 2 units of red blood cells were transfused to the patient. Bleeding did not stop, and therefore the ATAD Cook cervical double balloon device was inserted to control the massive cervical bleeding. Bleeding control was achieved by the pressure of the inflated balloons applied on the bleeding sites. After 2 days of stability, the double balloon device was removed and the patient discharged home. Additional literature report on this subject of ectopic cervical pregnancy. Double balloon cervical catheter for the control of massive hemorrhage in cervical ectopic pregnancy. A case report from Richmond University Medical Center by Nabila Zambrano, December 2017. A 31-year-old patient at 7 weeks gestation presented to the emergency room with complaints of vaginal massive bleeding. Transvaginal ultrasound was performed and revealed a 7 weeks gestation was noted within the cervical canal. After curettage, the patient continued to actively hemorrhage. Treatment: a silicone ATAD hook double balloon cervical device was introduced into the cervical canal. Both balloons inflated, one adjacent to the internal cervical opening inside the uterus, the other inside the bleeding site of the cervical ectopic pregnancy. Upon inflation of the balloons, the cervix was compressed between the two balloons of the device, and control of the massive bleeding from the cervix was rapidly achieved. Conclusion: the use of the ATAD Cook double balloon cervical device to achieve cervical tamponade during hemorrhage is immediate and highly effective. We are moving now to chapter 4 of the book. That means treatment of life-threatening ectopic pregnancy on a cesarean section scar. Literature citation: a novel, minimally invasive treatment for cesarean scar ectopic pregnancy by Professor Ilan Timur Trich, the New York University OB/GYN and Ultrasound Unit. Background: cesarean scar pregnancy and cervical pregnancy are forms of pathological pregnancies carrying significant diagnostic and treatment challenges. At times, life-saving surgery was required to treat massive bleeding and complications due to cesarean scar pregnancy and cervical pregnancy. Based on our previous success with using the ATAD Cook double balloon catheters for treatment of cesarean scar pregnancy, we evaluated the use of the same catheters to terminate the pregnancy while preventing bleeding without any additional treatment. The objective of the study was to describe the placement of the cervical double balloon catheter as a novel, minimally invasive treatment in patients with cesarean scar to terminate the pregnancy, at the same time to prevent bleeding by compressing the blood supply of the gestational sac. Cesarean scar pregnancy leads to loss of fertility, severe bleeding, and even maternal mortality. We intend to assess the effect of the double balloon cervical catheter insertion, the ATAD Cook device, on cesarean scar pregnancy termination. Conclusion: double balloon cervical insertion yield acceptable result to terminate cesarean section pregnancy. This strategy does not cause bleeding and even prevents it with the tamponade properties. Additionally, this treatment is minimally invasive, simple, with low morbidity and fertility preservation. Chapter 5: Intrauterine balloon tamponade in post-abortion massive hemorrhage. Publication: ATAD Cook double balloon cervical catheter works well as an intrauterine balloon tamponade in post-abortion massive hemorrhage. Publication by Dr. Chu, Department of Obstetrics and Gynecology, General Hospital, School of Medicine, Taipei, Taiwan. Case report. 2 patients with severe uterine hemorrhage are reported. Both patients were successfully treated with the double balloon cervical ATAD Cook catheters for intrauterine balloon tamponade to control massive post-abortion hemorrhage and postpartum hemorrhage. Now we are starting almost at the end of the book with chapter 6, means double balloon tamponade in the management of postpartum hemorrhage. That is a more common situation. We are presenting a case series by Dr. Kavak and Altri from the Firat University, Turkey. Abstract: to show the efficacy of the double balloon cervical catheter in the management of postpartum hemorrhage, originating from the lower segment of the uterus and the upper part of the cervix. Method: patients with intractable bleeding were treated by the double balloon devices. Results: double balloon catheter was used in 7 patients and it was properly placed in all of them. No other intervention was needed to control the bleeding. Conclusion: although double balloon cervical ripening catheters were designed for induction of labor, they can successfully control intractable bleedings from the lower segment of the uterus and the upper part of the cervix. This procedure can save patients from undergoing morbid radical procedure such as hysterectomy. Discussion: due to the low density of muscle fibers in the cervix, the control of the bleeding from the cervical canal can be more difficult. A balloon exerting pressure from both sides are more efficient to control bleeding from the lower part of the uterus and from the cervix. Balloons are inflated to a volume which can exert a pressure higher than the systemic arterial pressure of the patient and of the uterine wall. The balloon tamponades were kept inflated for 2 days with careful monitoring of the vital signs and then removed as the patient remained stable. One more publication on chapter 6 of the book is regarding postpartum hemorrhage, published by Zhong Hong Gu et al. From the OBGYN department, China, March 2022. Title of the publication is as follows: ATAD Cook cervical ripening balloon for placenta accreta disorders with placenta previa, means the presentation of the placenta was closed or covering the opening of the cervix. A novel approach to uterine preserving. Use of the ATAD Cook cervical balloon significantly reduced the rate of peripartum hysterectomy from 30% to 8.9% and was associated with a reduction in surgical amount of blood loss, median 2,500 milliliters versus 4,000 milliliters, and was associated with a reduction of amount of packed cells, blood, and fresh frozen plasma transfusion from 13 units to 6 units per patient. Conclusion of this publication by Honggu, China: the ATAD Cook cervical balloon is a simple, effective procedure for postpartum hemorrhage management and fertility preserving in previous cases in which abnormal invasive placenta reaches the cervical internal ostium and upper part of the cervical canal. Our study provides one of the tools in the hands of obstetricians who face the particular placenta previa disorders. And now we are arriving to the last chapter of the book that is called Manage Massive Hemorrhage During Outpatient Cervical Colonization Surgery. The title of the publication is Cervical Double Balloon Device: An Effective Use to Manage Massive Hemorrhage During Cervical Colonization by Reggio Emilia, Italy. Case report: a 35 years old patient with a high-grade cervical lesion was sent to our clinic to perform a cervical colonization. That means removing the cervix with the lesion. Under local cervical anesthesia, the lesion covering almost the entire cervix was removed by electrosurgical loop colonization. After the procedure, there was profuse bleeding coming from the cervix. Immediately, we attempted to buffer the bleeding in order to locate its source. We also tried to place sutures on cervix without success due to the massive hemorrhage. And the successful management was as follows. The cervical double balloon was inserted into the cervical canal until it covered the entire uterine orifice and was inflated with 20 milliliters of normal saline. Subsequently, the second balloon was placed into the vagina in contact with cervical bleeding crater and was inflated also with another 20 milliliters of saline solution. Following this intervention, the bleeding ceased. The patient was then transferred to the operating room where we discovered the origin of the bleeding coming from the descending branch of the right uterine artery. A stitch was placed and the bleeding resolved. After 2 days, the patient was discharged home without any further treatment. Thank you very much for your attention. I'm Dr. ATAD. My email address is atadjack@gmail.com. That will be presented to you at the end of the presentation. The end of my presentation is followed by an optional complimentary AI impression of my double balloon device invention, and lots of compliments are also given to me.
Ever wondered how a single medical invention, maybe designed for one specific thing, can end up Well, revolutionizing care in multiple, totally different critical areas of health.
It happens more than you might think.
Yeah. And today we're doing a deep dive into just such an incredible piece of medical innovation. It started with one clear mission, and then, through clinical experience, sheer ingenuity, really, it transformed into a lifesaver in completely unexpected situations. We're talking about the ATAD Cook cervical double balloon device. Now, you might not have heard that name before, but its impact on obstetrics and gynecology, well, it's been truly profound. Invented back in 2005 by Dr. Jack ATAD.
That's right. And Dr. ATAD, he's a very distinguished obstetrician and gynecologist, graduated from the Technion in Israel way back in 1974. His career had some really significant roles, like acting head of gynecologic oncology in Cape Town, South Africa, and the later head of gynecology oncology at Carmel Medical Center in Haifa, Israel. All that before this particular invention.
Quite the background. So this deep dive, it's based on a whole collection of medical literature spanning from 2005 right up to 2025.
Yeah.
And what these sources really show is how this device, originally conceived for, one specific purpose, unexpectedly became just invaluable for a whole range of critical bleeding emergencies. Okay, let's unpack this journey. So let's start right at the beginning. The original mission, the reason the ATAD Cook device was created, was for what's called ripening of the uterine cervix and induction of labor. We often just call it IOL.
Mm-hmm.
And this was especially for women who had what doctors call non-favorable cervical conditions.
Mm-hmm.
Basically, their cervix wasn't quite ready for labor to start or be induced.
And, inducing labor in those situations, it can be kind of tricky.
Right.
The traditional methods, they often involve medications, things like prostaglandin, but those can sometimes come with side effects, or maybe they don't work as well, higher failure rates, or they might even increase the risk of needing a C-section. So that's why mechanical methods that physically gently prepare the cervix, they're often preferred when the cervix isn't quite favorable. And this is really where the ATAD Cook device came into its own.
Okay, so the design itself, this is where it gets really interesting, I think. The ATAD Cook device, it's a double balloon catheter.
Mm-hmm.
So try to picture two small balloons on a single thin tube. One balloon inflates inside the uterus, right at the opening of the cervix. That's the internal cervical ostium. We call that the uterine balloon.
Yep.
And the other one inflates outside the uterus, down in the vagina at the other end of the cervix, the external cervical ostium. That's the vaginal balloon.
Mm-hmm.
And there's also this little thing called a stylet inside, which makes the catheter a bit firmer, just helps guide it into place more easily. It's elegantly simple, really, but very effective mechanically.
It really is. And the clinical studies, they've consistently highlighted some significant advantages for using it in labor induction. You're probably interested to hear it's linked with lower pain scores reported by women, which is a big deal.
Definitely.
Plus, there doesn't seem to be any increased risk of complications for the mother or the baby. There's a reduced risk of the uterus contracting too strongly, uterine hyperstimulation, which can cause fetal distress. And importantly, no increased risk of needing a C-section compared to other methods. It just effectively prepares the cervix in a gentle, controlled way.
And the research seems to really back this up consistently. There was a study in November 2019 comparing the double balloon to oxytocin for induction in women who'd given birth before.
Okay.
The balloon group, significantly faster time to delivery. We're talking about 9.5 hours versus over 13 hours for the oxytocin group.
Wow, that's quite a difference.
Nearly 4 hours faster. And then another study, this one from Germany in 2021, they looked at how long the balloon should ideally stay in. They compared keeping it in for 6 hours versus 12 hours.
Right, optimizing the timing.
Exactly. And they found that taking the balloon out after just 6 hours significantly cut down the total time from induction to delivery by almost 9 hours.
9 hours without downsides.
Without any reported adverse effects.
Yeah.
And even for women who had multiple births before, it still saved over 4 hours on average. Now, you might be wondering about women who've had a C-section previously. That's often a more complex scenario for induction.
Mm-hmm, definitely.
Well, a Spanish study showed that using the ATAD Cook catheter actually improved the Bishop scores. That's basically a measure of how ready the cervix is. And it reduced the amount of time oxytocin was needed later on, all without increasing complications for women who'd had just one previous C-section.
That's encouraging.
Yeah. And another study directly compared women giving birth for the first time, the nulliparous patients, with women attempting a vaginal birth after a previous C-section, that's often called TEOAC, and they found really similar rates of successful vaginal delivery in both groups. The C-section rates were around 29% for both. So it suggests it's a safe and effective option for women attempting labor after one prior C-section without adding extra risks for mom or baby.
That's very useful data. It's important to remember, though, while it's incredibly versatile and safe for induction in many cases, there are specific situations where it really shouldn't be used.
Right, contraindications.
Exactly. The main ones are placenta previa, that's where the placenta is covering the cervix, and also if a woman has had more than one previous C-section. Those are the key exclusions for induction use.
Okay, good to know. So just for labor induction alone, this device is, it's clearly a bit of a game changer, right? Offering a gentler, often faster and safer option for many women.
Absolutely.
But, and this is where it gets really fascinating to me, the medical literature over the last, say, 20 years started showing its incredible effectiveness in a completely different area, a much more urgent one. Emergency bleeding situations.
Yeah.
This is where the story of the ATAD Cook device just takes this unexpected, compelling turn.
It really does. And when you think about stopping bleeding, the core principle is often what we call tamponade.
Like applying pressure.
Exactly, like applying direct pressure to stop bleeding from a vessel. The double balloon's unique design, with one balloon inside and one outside the cervix, allows it to exert pressure from both sides simultaneously. It effectively clamps down on the bleeding source within the cervix itself, and this can be particularly effective in, let's say, challenging anatomical spots where just packing something in might not work as well.
Okay, that makes sense mechanically. So let's look at the first big emergency application. Massive hemorrhage in cervical ectopic pregnancies.
Right.
Now, this is rare, thankfully, but it's a really life-threatening type of ectopic pregnancy where the embryo implants right in the cervix, not in the uterus or tubes.
A very dangerous location.
Extremely. The main goals when this happens are, obviously, stop the bleeding, remove the pregnancy tissue, and, crucially if possible, preserve the woman's fertility.
Which is a major challenge. Historically, these situations often ended in a hysterectomy, removing the uterus entirely.
Meaning no future pregnancies.
Correct. But nowadays, the push is towards more conservative approaches, trying to avoid hysterectomy. Things like using chemotherapy drugs, maybe methotrexate, or injections of potassium chloride, often combined with surgical removal, aiming to preserve fertility.
And this is where the double balloon has emerged as a really valuable adjuvant tool, something used alongside these other treatments.
Exactly, an extra tool in the toolbox.
We've got several case reports showing just how effective it can be. Back in 2016, one report described a 28-year-old woman with massive bleeding, like almost a liter of blood loss, after other treatments hadn't worked. They inserted the double balloon, inflated it, and it successfully controlled a hemorrhage. Then another case, 2017, a 31-year-old, again with significant bleeding after chemotherapy for a cervical ectopic. The double balloon, by compressing the cervix between those two inflated parts, it rapidly stopped the bleeding, achieved hemostasis.
Incredible immediate effect.
Yeah. And even more recently, a 2023 case from the Medical College of Wisconsin. This is a complex one. A 13-week cervical ectopic pregnancy where the standard medication, methotrexate, hadn't worked. They used a combination of injections and immediately placed the ATAD Cook double balloon inside the cervix, leaving it there for 72 hours. And it worked. Successful resolution, and crucially, the patient's fertility was preserved.
That's fantastic news in such a difficult case.
It really is. And even going back further, a UK case from 2009 showed it being used successfully to stop bleeding after a surgical evacuation of the cervical ectopic, just highlighting its role in maintaining stability and preventing rebleeding.
It is quite remarkable, isn't it, how a device designed for, the gentle process of preparing for labor can also be so effective at stopping potentially fatal bleeding.
It seems counterintuitive at first.
It does, but it comes down to that targeted mechanical compression. It essentially creates this focused internal clamp right where the bleeding is originating in the cervix. It can stop the flow very quickly, often buying time for other treatments or avoiding much more invasive surgery like hysterectomy. And that preservation of fertility is just huge for these women.
Absolutely huge. Okay, moving on to another really critical application, these life-threatening ectopic pregnancies that implant on a cesarean section scar, often just called CSP.
Yes, another very serious condition.
Yeah, another type of pathological pregnancy that can cause severe bleeding, loss of fertility, and is genuinely life-threatening for the mother. Here, Professor Ilan Timur-Trich and his team at NYU, they described a really groundbreaking, minimally invasive approach, using these double balloon catheters specifically to terminate the CSP while simultaneously preventing bleeding by compressing the blood supply around the gestational sac.
A proactive approach using the balloon's tamponade effect.
Exactly. And the results reported have been quite compelling. A study from just January 2024 found that using the double balloon for CSP termination gives, quote, acceptable results.
Okay.
They noted it does not cause bleeding and even prevents it with its tamponade properties. And they highlighted that it's minimally invasive, simple, low morbidity, and something obstetricians are already familiar with using.
Familiarity is key for adoption.
Definitely. And most importantly, again, patient's fertility is preserved. Then, further research from Washington University backed this up. They found the balloon was an effective and safe option for CSP. Very few patients in their study, only 2 out of 34, needed any additional procedures.
That's a high success rate.
Extremely high.
Yeah.
And none of the patients required a hysterectomy or even a blood transfusion. So the data really suggests it's a successful, non-surgical, fertility-sparing treatment option. They even noted it worked for twin CSP gestations.
That's fascinating. And if you sort of connect this to the bigger picture, it really represents a major shift, doesn't it?
How so?
Well, we're moving away from these reactive, often life-altering surgeries like hysterectomy that were sometimes the only option, towards proactive, minimally invasive interventions, techniques that actively protect a woman's future fertility choices. It fundamentally changes the outlook for these dangerous pregnancies from potentially catastrophic to manageable with preserved options.
That's a really powerful perspective. Okay, let's talk about bleeding after a pregnancy ends, either abortion or childbirth. The device has proven invaluable here too, right?
Yes, absolutely. For severe hemorrhage after an abortion, what's called post-abortion hemorrhage, or PAH, there's a report from Taiwan. Doctors there successfully used the double balloon as an intrauterine tamponade device in 2 cases of really severe bleeding. It worked, avoided hysterectomy, and preserved fertility in both instances.
Amazing. And then postpartum hemorrhage, PPH. This is a huge global issue, a major cause of maternal death worldwide.
A critical emergency, yes. And a team in Turkey reported using the double balloon successfully in 7 cases of really stubborn, intractable bleeding coming specifically from the lower part of the uterus and the upper cervix after childbirth.
Bleeding that wasn't stopping with other measures.
Exactly. And the balloon placement was all that was needed. No other intervention was required. They specifically highlighted its unique ability to put pressure on both sides of the cervix, which is crucial in that lower segment area. The muscle fibers there are a bit less dense, so bleeding can be harder to control just by uterine massage or medication alone.
So it targets that difficult zone specifically.
Precisely.
And its usefulness seems to extend to even more complex PPH scenarios.
It does. For instance, another report from Turkey in 2022 described using it to stop bleeding, originating from the cervical canal in patients who had placenta previa and delivered by C-section.
Why is that significant?
Because that specific type of bleeding, coming from deep within the cervical canal, often can't even be seen properly through the C-section incision in the uterus.
Okay.
So being able to insert the balloon vaginally and apply direct internal pressure right at the source was absolutely vital in preventing a C-section hysterectomy in those cases.
Wow. And then there's perhaps one of the most striking results I saw. A Chinese study from 2022 looked at something called placenta accretus spectrum disorders, or PAS.
Yes, PAS, where the placenta implants too deeply, sometimes invading the uterine muscle or even beyond. It's a very high-risk condition, and sadly, its incidence seems to be rising globally, linked partly to rising C-section rates.
Okay, so in this study, they focused on PAS cases where the placenta was also low-lying, placenta previa, and the invasive part actually reached the internal opening of the cervix, a very dangerous combination.
Extremely dangerous, high risk of massive hemorrhage at delivery.
And what they found was that using the ATAD Cook cervical balloon in these specific high-risk cases, it dramatically reduced the rate of peripartum hysterectomy, needing a hysterectomy right at the time of delivery.
Dramatically.
Get this, the hysterectomy rate dropped from over 30% down to just 2.9%.
That's monumental, truly monumental.
Isn't it? And it also significantly cut down on blood loss and the need for blood transfusions. In a condition that's becoming more common and is inherently life-threatening, that kind of improvement is just incredible.
Incredible is the right word, saving lives and preserving fertility in one of the most challenging obstetric scenarios.
Okay, one last application area, maybe less common,
Yeah.
just as critical when it happens. A case report from Italy about managing hemorrhage during outpatient cervical condomization?
Condomphysization. So that's a procedure to remove abnormal cells from the cervix, right? Usually quite safe.
Exactly. It's a common outpatient procedure, often for high-grade cervical lesions. Massive bleeding is rare, maybe happens in 2 to 4% of cases, but when it does, it's serious. So in this specific case, a 35-year-old woman started bleeding profusely after her condomphysization procedure, over a liter of blood loss. They tried sutures, but the bleeding just wouldn't stop.
A nightmare scenario in an outpatient setting.
Absolutely.
Yeah.
So the medical team, thinking quickly, and as the report says, in an unconventional but incredibly effective manner, they located an ATAD Cook cervical double balloon. They inserted it, inflated both balloons around the bleeding cervix. It immediately stopped the bleeding. Just like that.
Wow, instant tamponade.
Instant tamponade. It bought them the crucial time they needed to safely transfer the patient to a proper operating room. There, they found the source was actually a uterine artery branch that needed stitching. But the balloon held the fort. The patient was discharged later without even needing a blood transfusion.
That single case just perfectly highlights the device's versatility, doesn't it? And its immediate life-saving potential, even popping up in unexpected acute bleeding situations completely outside the usual labor and delivery context.
Yeah.
It really underscores how critical thinking by clinicians, combined with having adaptable tools like this available, is just absolutely essential in emergency medicine. It can turn a potentially catastrophic situation into a manageable one almost instantly.
So, reflecting on this whole deep dive, what really stands out to you? For me, it's not just the incredible breadth of application for this ATAD Cook device, but the whole story it tells. Starting from this gentle purpose, preparing the cervix for labor, and then evolving through experience to become this tool that forcefully stops life-threatening hemorrhages in so many different contexts. It sounds like a perfect example of innovation born directly from clinical need and ingenuity.
I completely agree. What stands out to me is the profound impact on patient outcomes. This device doesn't just, simplify a procedure like labor induction or maybe make it a bit more comfortable. In these emergency bleeding scenarios, it does something far more profound. It preserves fertility, and it literally saves lives in situations that not too long ago were often considered unmanageable without resorting to drastic surgeries like hysterectomy. The data we've discussed clearly shows its impact, reducing hysterectomies, reducing blood transfusions. Those aren't just statistics. Those are monumental gains for individual patients' well-being, their future health, and their future life choices.
So what does this all mean for you listening in? I think it means that sometimes even these seemingly simple mechanical solutions can have just a massive, monumental impact in medicine. And that innovation isn't always about the highest tech thing. It's about constantly evolving, adapting tools and techniques to meet new, sometimes unexpected challenges. It really proves that sometimes the most elegant solutions turn out to be the most powerful ones too.
Well said.
Until our next deep dive, keep exploring, keep questioning, and keep being well informed.